IV induction agents. Propofol. The dose. What is the dose? It is 2 to 2.5 milligrams a kilogram. 2 to 2.5 milligrams a kilogram. What is its onset? 30 to 40 seconds. 30 to 40 seconds. What is peak effect? At 60 seconds. The peak effect is at 60 seconds. How long does it last for? 4 to 8 minutes. 4 to 8 minutes. What is the half-life? 1 to 3 hours. 1 to 3 hours. Elimination for propofol. Hepatic and pulmonary. Hepatic and pulmonary. What is the mechanism of action? GABA agonist. It is a GABA agonist. Etomidate. What is the dose of etomidate? Well, I hope you're saying 2 to 0.3. 0.2 to 0.3 milligrams a kilogram. Milligrams a kilogram. What is its onset? 30 to 60 seconds. 30 to 60 seconds. Peak effect is at 60 seconds. How long does it last for? Duration. 4 to 8 minutes. 4 to 8 minutes. What is etomidate's half-life? About 3 hours. 3 hours. What is elimination? Hepatic. What is etomidate's mechanism of action? GABA agonist. Ketamine is the next drug. What is the dose for ketamine? 1 to 2 milligrams a kilogram. 1 to 2 milligrams a kilogram. Onset, 30 to 60 seconds. 30 to 60 seconds. Peak effect, at 60 seconds. The duration for it. The duration for ketamine, 5 to 10 minutes. Half-life. What is its half-life? 3 hours. What is elimination for ketamine? Hepatic. It is an NMDA antagonist. NMDA antagonist. Next up for IV inductionation, we have midazolam. What is the dose? The midazolam dose is 0.15 to 0.35 milligrams a kilogram. Let me say that again. It is 0.15 to 0.35 milligrams a kilogram. What is its onset? 30 to 120 seconds. 30 to 120 seconds. Peak effect is expected at 3 to 5 minutes. 3 to 5 minutes. What is the duration? 15 to 80 minutes. 15 to 80 minutes. And the half-life for midazolam or Versed is 1.5 to 3.5 hours. Hope you're saying 1.5 to 3.5 hours. Elimination is hepatic. It is a benzo agonist on GABA. Benzo agonist on GABA. Alright, next drug, dexmedetomidine. What is the dose? 1 mcg per kilogram over 10 minutes. 1 mcg per kilogram over 10 minutes. Sedation dose we do not talk about. However, it is 0.2 to 0.7 mcg per kilograms per hour. 0.2 to 0.7 mcg per kilograms per hour. And just a quick question going back to midazolam. What is the sedation dose for midazolam? Well, I hope you're saying it is 1 to 5 milligrams. 1 to 5 milligrams for midazolam. Going back to dexmedetomidine or Precedex. What is the onset? 10 to 15 minutes. 10 to 15 minutes. What is the peak effect? Well, it's during infusion. It's during infusion. What is the duration? 4 hours. 4 hours. What is the half-life of Precedex or dexmedetomidine? Well, I hope you're saying 2 hours. 2 hours. Elimination is done hepatically. Hepatically. What is alpha-2 agonist is its action? Lidocaine, specifically in the case of IV induction agents, what is the dose that you give? Well, I hope you're saying 1 to 1.5 milligrams a kilogram. 1 to 1.5 milligrams a kilogram. Onset is 45 to 90 seconds. 45 to 90 seconds. When is the peak effect of lidocaine? Well, I hope you're saying 1 to 2 minutes. What is the duration of lidocaine? 10 to 20 minutes. What is the half-life of lidocaine? 1 to 2 hours. What is elimination for lidocaine? I hope you're saying hepatic. Lidocaine is eliminated hepatically. What is its mechanism of action for lidocaine? Amide sodium channel blocker. Amide sodium channel blocker. So, to state one more time, IV induction agents. What are our IV induction agents? They're propofol, etomidate, ketamine, midazolam, Precedex, and if you're using lidocaine in sequence with them. My name is Vlad. I'm a resident over at NYU Anesthesiology Department, and I would like to go over drugs. First, we're going to start with an inhalation agent. For nitrous oxide, what is its MAC? 104. 104. What is the blood gas coefficient? 0.47. 0.47. Desflurane. What is the MAC? 6. 6. MAC in 60 to 70% N2O? 2.8. 2.8. What is desflurane's blood gas coefficient? 0.42. 0.42. Sevoflurane. What is the MAC of sevoflurane? 2.1. 2.1. What is the MAC in 60 to 70% N2O? 0.66. 0.66. What is the blood gas coefficient? 0.63 to 0.69. 0.63 to 0.69. Isoflurane. What is its MAC? 1.15. What is the MAC in 60 to 70% N2O? 0.5. 0.5. What is the blood gas coefficient for isoflurane? Well, I hope you're saying 1.43. 1.43. And how do these inhalation agents work, such as desflurane, sevoflurane, isoflurane? They disrupt the membrane, TREC1, and there is a hypothesis for GABA modulation. GABA modulation. What is MAGBAR? MAGBAR blunts adrenergic responses to noxious stimuli. Blunts adrenergic responses to noxious stimuli. 1.5 higher than standard MAC. Let me say that one more time. It is 1.5 higher than standard MAC. MAC awake. What is MAC awake? Well, I hope you're saying at which a patient opens his or her eyes to command. It's 0.5 of MAC. 0.5 of MAC. Effects of age on MAC. There's approximately a 6% decrease per decade after age of 40. Let me say that one more time. What is the effect of age on MAC? There's approximately a 6% decrease per decade after age of 40. That concludes inhalation agents. Next up is opioid comparison. We're going to be talking about alfentanil, fentanyl, all of those nice things. So the first drug that I'm going to speak about is fentanyl. What is the approximate analgesic equivalent for fentanyl? I hope you're saying 50 mcgs. 50 mcgs. Fentanyl's peak onset, 3 to 5 minutes. 3 to 5 minutes. Duration of action of fentanyl, single bolus only, is 30 to 60 minutes. 30 to 60 minutes. Especially if you're using it in infusion, you need to use it with caution. Infrequently, it is used given long context-sensitive half-life. Again, it is infrequently used given the long context-sensitive half-life. Alfentanil is the next drug we're going to discuss. Approximate analgesic equivalent is 150 to 250 mcgs. That is 150 to 250 mcgs. Peak onset for alfentanil, 1 to 2 minutes. 1 to 2 minutes. Duration of action, 5 to 10 minutes. 5 to 10 minutes. It is not commonly used in infusions. Hydromorphone or Dilaudid. What is the approximate analgesic equivalent? Well, I hope you're saying 0.75 milligrams. 0.75 milligrams. When is the peak onset for Dilaudid or hydromorphone? 5 to 15 minutes. 5 to 15 minutes. Duration of action. It is 2 to 4 hours. 2 to 4 hours. Where are Dilaudid infusions used? In the intensive care unit. In the intensive care unit. Meperidine is the next drug of choice. What is the approximate analgesic equivalent? 37.5 milligrams. 37.5 milligrams. Peak onset for meperidine, 5 to 15 minutes. 5 to 15 minutes. What is duration of action? 2 to 4 hours. 2 to 4 hours. Is it ever used in infusion? No, it is not. Morphine. What is the approximate analgesic equivalent? 5 milligrams. 5 milligrams. What is the peak onset? 10 to 20 minutes. 10 to 20 minutes for morphine. Duration of action. It typically works for 45 hours. 4 to 5 hours. Is it ever used as an infusion? Yes, ICU for comfort care. What is the next drug that we're going to talk about is methadone. Methadone's approximate analgesic equivalent, 2.5 milligrams. 2.5 milligrams. What is the peak onset? 10 minutes. 10 minutes. What is duration of action? Methadone lasts for 24 hours. 24 hours. Is it ever used in infusion? No. No. Remifentanil. What is the approximate analgesic equivalent? 50 mcgs. 50 mcgs. What is peak onset? 3 to 5 minutes. 3 to 5 minutes. Duration of action? 5 to 10 minutes. 5 to 10 minutes. Is it ever used as an infusion? Yes, in the operating room. In the operating room. What is the next drug that we're accustomed to? Sufentanil. Sufentanil. What is the approximate analgesic equivalent? 5 mcgs. 5 mcgs. What is the peak onset for sufentanil? 3 to 5 minutes. 3 to 5 minutes. What is duration of action of sufentanil? 20 to 45 minutes. 20 to 45 minutes. And is it ever used in infusion? Yes, in the operating room. In the operating room. Neuromuscular blockers. Here we're going to speak about succinylcholine, rocuronium, vecuronium, and cisatracurium. What is the intubation dose for succinylcholine? Well, I hope you're saying 1 to 1.5 milligrams a kilogram. 1 to 1.5 milligrams a kilogram. If there were defasciculation doses using non-depolarizing muscular blocker, you use 1.5 milligrams a kilogram. This should be pretty intuitive. There is no maintenance dose with 1 to 2 twishes for succinylcholine. There are no maintenance doses for succinylcholine. We don't ever use it for maintenance doses. What is its onset for intubation? Well, I hope you're saying 30 to 60 seconds. 30 to 60 seconds. What is its peak? Well, I hope you're saying 60 seconds. What is succinylcholine's duration? 4 to 6 minutes. 4 to 6 minutes. What is its half-life? Approximately 1 minute. 1 minute. How is succinylcholine eliminated? Plasma cholinesterases. Plasma cholinesterases. What is the mechanism of action of succinylcholine? It's an acetylcholine agonist. Acetylcholine agonist. Rocuronium is our next drug. What is the intubation dose for rocuronium? Well, I hope you're saying zero point 0.6 to 1.2 milligrams a kilogram. 0.6 to 1.2 milligrams a kilogram. And if you're doing rapid sequence intubation, it's 1.2 milligrams a kilogram. Maintenance dose for rocuronium, 0.15 milligrams a kilogram. 0.15 milligrams a kilogram. When does onset happen for rocuronium? Well, I hope you're saying 60 to 120 seconds. 60 to 120 seconds. When is peak for rocuronium? Approximately 1 to 3 minutes. 1 to 3 minutes. What is the duration for rocuronium? Well, I hope you're saying 30 to 85 minutes. 30 to 85 minutes. What is the half-life of rocuronium? Well, I hope you're saying 1.4 hours. 1.4 hours. How is rocuronium eliminated? Hepatically and renally. Hepatically and renally. What is the mechanism of action of rocuronium? Well, I hope you're saying nicotinic muscarinic antagonist. Nicotinic muscarinic antagonist. It is an NN presynaptic channel. NN presynaptic channel. Next up is vecuronium. What is the intubation dose for vecuronium? Well, I hope you're saying 0.1 milligrams a kilogram. 0.1 milligrams a kilogram. What is the maintenance dose for 1 to 2 twitches? Well, I hope you're saying 0.05 milligrams to kilogram. 0.05 milligrams a kilogram. What is the onset for intubation? It takes about 2 to 3 minutes. 2 to 3 minutes. What is the peak for vecuronium? I hope you're saying 3 to 5 minutes. 3 to 5 minutes. What is the duration of action of vecuronium? 30 minutes. 30 minutes. What is the half-life for vecuronium? 1 to 1.5 hours. 1 to 1.5 hours. And vecuronium is eliminated hepatically and renally. Hepatically and renally. What is the mechanism of action of vecuronium? Nicotinic muscarinic antagonist. Nicotinic muscarinic antagonist. And it acts on NN presynaptic channel. That's for nicotinic. Cisatracurium, intubation dose, 0.1 to 0.2 milligrams a kilogram. Cisatracurium, intubation dose, 0.1 to 0.2 milligrams a kilogram. What is the maintenance dose to maintain 1 to 2 twitches? 0.02 milligrams a kilogram. 0.02 milligrams a kilogram. Onset of intubation, 2 to 3 minutes. 2 to 3 minutes. When is the peak? Approximately 3 to 5 minutes. 3 to 5 minutes. What is the duration for cisatracurium? 30 minutes. 30 minutes. What is the half-life for cisatracurium? 30 minutes. 30 minutes. How is it eliminated? Cisatracurium, how is it eliminated? Hoffman reaction. It's a nicotinic muscarinic antagonist, and it's an NN presynaptic receptor nicotinic. Now we're going to speak about reversal agents, neostigmine, glycopyrrolate, and sugammadex. Let's begin with sugammadex. The first thing that we're going to speak about is the dose. Sugammadex dose is 2 milligrams a kilogram for 2 twitches, if the patient is showing 2 twitches, and 4 milligrams per kilogram if there are no twitches. If you essentially are trying to reverse the patient right away after full induction, what is the dose? Well, I hope you're saying 16 milligrams per kilogram. 16 milligrams per kilogram, minutes after induction. How is fast as the onset? Fast. Peak? Fast. Duration? Well, depends on the dose. And then half-life is approximately 120 minutes. How is it eliminated? Renally. What is the mechanism of action of Sugammadex? It is gamma cyclodextrin complexes with rocuronium or vecuronium. Once again, there's a gamma cyclodextrin complexes with rocuronium or vecuronium. So it's essentially a gamma cyclodextrin molecule double complex with those rock or ver. Now, neostigmine. What is the dose for neostigmine? 0.02 to 0.07 milligrams a kilogram. Essentially, if you have 2 to 3 twitches, you want to use 0.05 milligrams a kilogram. If you're seeing 4 twitches fade, then 0.04 milligrams per kilogram. If there's 4 twitches and no fade, 0.015 to 0.025. Onset, 1 to 5 minutes. 1 to 5 minutes. Peak, 5 minutes. 5 minutes. What is the duration? 60 to 120 minutes. 60 to 120 minutes. What is the half-life? 60 to 120 minutes. 60 to 120 minutes. What is elimination? Hepatic and plasma cholinesterases. Hepatic and plasma cholinesterases. What is the mechanism of action of neostigmine? It is an anticholinesterase. Anticholinesterase. Glycopyrrolate. What is the dose that we give? It's 0.2 milligrams per milligram of neostigmine. 0.2 milligrams per milligram of neostigmine. What is the onset? 1 minute. What is the peak? 5 minutes. What is the duration of glycopyrrolate? 2 to 3 hours. 2 to 3 hours. What is the half-life? 80 minutes. 80 minutes. What is the elimination? Hepatic and renal. Hepatic and renal. What is the mechanism of action of glycopyrrolate? Antimuscarinic. Antimuscarinic. Wanted to talk to you about crystalloids and colloids. However, in this instance, we're only going to talk about crystalloids. What is the osmolarity of normal saline? Well, I hope you're saying it is 308 milliosms per liter. 308. What is the sodium concentration in normal saline? Well, I hope you're saying 154. 154. How much chlorine is concentrated in a crystalloid? 154. 154. How much potassium is in normal saline? Nothing. There's no calcium, no buffer, no glucose. Next up is lactate ringers. What is the osmolarity of lactate ringers? It's 273. 273. How much sodium is in lactate ringers? 130. 130. How much chlorine is in LR? 109. 109. How much potassium is in LR? It's 4. 4. How much calcium is in LR? It is 3 milliequivalents per liter. What is the buffer? It's lactate metabolized to bicarbonate, and it's 28. 28. Is there any glucose in LR? No, there isn't. No, there isn't. Normazole, also known as plasmalite. What is its osms? 294. 294. What is sodium? It's 140. 140. What is chlorine? 98. Normazole has 98 chlorine. What is potassium? It's 5. Is there any calcium in Normazole? No, there isn't. What is the buffer in Normazole? It's acetate, and it's 27 milliequivalents per liter. Is there any glucose in Normazole? No, there isn't. D5W, what is its osms? It's 253. 253. It doesn't have anything besides glucose, which is 50 grams per liter. 50 grams per liter. Antiemetics. briefly we talk about ondansetron and dodecadron only. What is the dose for ondansetron? It's 4 milligrams. 4 milligrams. What is the onset for it? Less than 30 minutes. Less than 30 minutes. What is the peak? 2 hours. 2 hours. Ondansetron duration? 12 hours. 12 hours. What is the half-life elimination? I hope you're saying 3.5 hours. 3.5 hours. How is ondansetron eliminated? Hepatically. Hepatically. And mechanism of action. It's a serotonin or 5-HT3 antagonist. 5-HT3 antagonist. Dodecadron is our next drug. Dose is 4 milligrams. What is the onset? Dodecadron works 5 minutes and then 4 to 8 hours. 5 minutes and then 4 to 8 hours. What is the peak? Well, it's approximately 6 to 12 hours. 6 to 12 hours. What is the duration? 24 to 72 hours. 24 to 72 hours. Half-life? 3.5 to 4.5 hours. 3.5 to 4.5 hours. It is eliminated hepatically and is a glucocorticoid. Here we're going to discuss local anesthetics. Lidocaine, bupivacaine, ropivacaine, and Exparel. We're going to start with lidocaine. What is the onset of lidocaine? It is rapid to moderate. Important difference to note because all the other ones are moderate. So it's rapid to moderate. During the spinal procedure, essentially 60 to 70 minutes. Duration during the spinal procedure, 60 to 70 minutes. 60 to 70 minutes. Duration epidural, 60 to 120 minutes. 60 to 120 minutes. What is the maximum dose of lidocaine that you can give to a patient? It is 350 milligrams plain. 350 milligrams plain. Or 500 milligrams per epi. 500 milligrams per epi. What is the maximum dose plain of milligrams per kilogram that we can give to a patient? It's 4.5 milligrams per kilogram. 4.5 milligrams per kilogram. What is the maximum dose with epi? 7 milligrams per kilogram. 7 milligrams per kilogram. What is the pKa of lidocaine? Well, I hope you're saying 7.9. 7.9. What is the elimination for lidocaine? It's hepatic. It's hepatic. What is the mechanism of action, and really action for all the local anesthetics? Amide sodium channel blocker. Amide sodium channel blocker. Bupivacaine. What is the onset for bupivacaine? Moderate. What is duration for the spinal? 2 to 3 hours. 2 to 3 hours. What is duration epidural? 120 to 200 minutes. 120 to 200 minutes. What is the maximum dose? Well, if you're giving it plain, I hope you're saying 175 milligrams plain. 175 milligrams plain. Maximum dose for, in the epi situation, 225 milligrams of an epi. 225 milligrams per epi. What is the maximum dose plain? 2.5 milligrams per kilogram. 2.5 milligrams per kilogram. What is the max dose with epi? 3 milligrams per kilogram. 3 milligrams per kilogram. What is the pKa for bupivacaine? I hope you're saying 8.1. 8.1. It's eliminated hepatically, and likewise it's an amide sodium channel blocker. Ropivacaine. Onset is moderate. Duration during the spinal, 2 to 3.5 hours. What is duration during epidural? 120 to 180 minutes. 120 to 180 minutes. What is the maximum dose? 200 milligrams plain or 250 milligrams plain or 250 milligrams per epi. What is the maximum plain milligrams per kilogram? I hope you're saying 3 milligrams per kilogram for ropivacaine. I hope you're saying 3 milligrams per kilogram. Ropivacaine's maximum dose with epi, 3 milligrams per kilogram. 3 milligrams per kilogram. What is the pKa for ropivacaine? Well, I hope you're saying 8.1. 8.1. What is elimination for ropivacaine? Well, I hope you're saying hepatic. I hope you're saying hepatic. And likewise, it's an amide sodium channel blocker. Now, last one, Exparel. Exparel. What is the onset? It is moderate. Duration during the spinal, 96 hours after local infiltration, and 120 hours after interscalene brachial plexus nerve block. Once again, 96 hours after local infiltration, and 120 hours after interscalene brachial plexus nerve block. What is the duration of epidural? Well, it doesn't exist. Exparel does not get used as a duration for the epidural. What is the maximum dose? Well, I hope you're saying 266 milligrams for Exparel, or 20 milliliters. Is there a maximum dose for plain or maximum epi? No. What is the pKa of Exparel? It is 8.1. pKa is 8.1. What is really Exparel? Exparel is bupivacaine liposome injectable suspension. Once again, it's a bupivacaine liposome injectable suspension. It's eliminated hepatically, and it's an amide sodium channel blocker.